Thank you very much for the invitation. King's Health Partners has been a source of inspiration and practical support since Sydney Health Partners was established in 2016. In truth, we've had no shame in copying your ideas and ways of working that fit with our structure and priorities. And I'm personally particularly grateful for the advice and practical support that we've received from King's Health Partners over these past 6 years. I've been asked to provide you with a brief update of Sydney Health Partners, partly as a point of reference for the extraordinary work that you do as King's Health Partners. And from the beginning, I think I want to point out that although the UK academic health science centres were an important source of ideas in Australia, the centres that have been established here do have a different genesis and mission as research translation centres. And importantly, they're required to be health services led as centres. And my presentation probably needs to be considered in that context. If I could have the next slide, please. So this will be very familiar to many of you at the conference, but it's worth looking at just to get some sense of perspective when we're considering what a research translation centre like Sydney Health Partners has been set up to do. You'll be familiar with this attempt to communicate some kind of a magical linear relationship between basic innovative discovery science and its eventual translation to economic and social benefits to our community. And you'll know that basically there are two primary areas of research translation. One is the process of applying discoveries that are generated from basic sciences, from highly innovative discovery research to preclinical studies and the development of trials in humans, the so-called bench to bedside research. And I know that a great deal of where King's Health Partners contributes to the advancement of knowledge is in this bench to bedside research. And it's been very inspirational for all of us in that work. The second major area, though, is the process, of course, that delivers optimal benefit both to the economy and to the health of our population. And that's moving from the bedside to the application of innovation in the clinic, in the health system, and in health policy into the wider community. Have the next slide, please. And of course, you'll be aware that most of our focus in research translation is on these two critical bottlenecks. What prevents us from getting discovery and innovation in the laboratory transferred to the clinic, and what then prevents the adoption of proven interventions as standard practice. Both are extremely important, and I'll have to say in Australia, the government, both the national federal government and at state level, have invested enormously in trying to overcome some of the bottlenecks that have prevented discovery science being converted into practical application in the clinic. But the research translation centres, as they've been established in Australia, with their focus on health services-led research, tend to focus a bit more on the second of these bottlenecks, the one that prevents us from getting interventions of proven efficacy adopted into standard practice, introduced systemically at scale and pace in the health system in order to deliver the optimal benefit to the population and also at scale to deliver optimal economic benefit. Have the next slide, please. This gets us into territory that's often unfamiliar to people who've been traditionally involved in research translation. If we look at the T2 to 4 in the diagram that I presented earlier, research translation actually gets us involved in some quite different types of research with quite different research skills. A lot of it's to do with understanding how the health services work and how we get interventions of proven efficacy implemented at scale and at pace in complex health services. It involves us in evaluating interventions in real world settings, which is often quite complex and messy. It's almost always multidisciplinary, draws upon a wide range of different scientific paradigms, including the use of communication theory and behavioral science, informatics, and health economics. Some of you will be very familiar with this. It also, probably more than some of the earlier phases in research, involves a strong commitment to engaging patients and consumers across the continuum. Have the next slide, please. It's in this context that Sydney Health Partners was established 6 years ago. You'll see from this slide the partnership consists of 3 large local health districts, as they're organised in Australia, each of them serving a population of around about 1 million people, and the largest children's hospital in the Southern Hemisphere, the Children's Hospital at Westmead, as well as the University of Sydney, a major research-intensive university in Australia. We have about 50,000 students, and about 2/3 of our entire research income is in health, medicine, and the life sciences. So a pretty big enterprise. We're also supported by 10 affiliated independent medical research institutes across a range of specialties and subject areas and across our geography. Next slide, please. All up, we're a very large partnership. We deliver healthcare to about 1 in 9 Australians and about 1/3 of the population of New South Wales in Australia. We generate significant research income, about $250 million annually, in what is overall a multi-billion-dollar research ecosystem. And not surprisingly, it's generating a lot of conventional outputs. We're engaged in a large number of investigator-led and commercial clinical trials. And we're connected to, but not actually systematically linked to, our state and national health ministries and healthcare systems. As an organisation, as Sydney Health Partners, though, as this organisation, we're actually quite small, and we need to be clear about where we'll add the most value in such a large healthcare system. Have the next slide, please. So our mission really has been, it can be summarised in this slide. Our primary focus, given our health services orientation, is to deliver public and patient benefit. We're obviously significantly about achieving effective collaboration among our partners, trying to achieve more as a collective than we can achieve individually. Importantly, we're really interested in doing things at scale, creating a collaborative translational research model, and finally, particularly working with our university partners and our medical research institutes, we want to find a way to create a sum that's greater than the parts to improve our international competitiveness. Have the next slide, please. So we've focused our work as Sydney Health Partners in these 4 priority areas, and I'll probably wrap up after explaining a bit more of this. Firstly, we've seen that we have a unique role in our partnership in supporting capacity and capability building, especially for earlier career clinician researchers. And we've been particularly focused on trying to provide a supportive, career-oriented structure to support our career clinician researchers. Secondly, we have brokered a very powerful dialogue between our health service organisations and our research capabilities, particularly the university and our medical research institutes. If I were rude about this, we have a great track record in providing perfect answers to questions that no one had actually asked. By brokering a dialogue between our researcher capability and our the needs and priorities of our health services partners, we're getting research questions addressed that are of great importance to our healthcare system. Thirdly, we do a lot of work behind the scenes that our researcher community have told us is really important to them. Trying to improve the governance and ethics processes that dog our researcher community, especially those that want to work in multiple sites. Trying to unlock the tremendous resources in terms of data and information held by our healthcare providers to ensure that our researchers have great access to that. Systematically facilitating consumer involvement in health research, and providing a whole range of different clinical trials support, type of thing that you can find on our website if you're interested. And finally, we found a specific and distinctive role for Sydney Health Partners in advancing the science of research translation, particularly through our understanding of implementation science. And we're in the process at the moment of establishing an implementation science academy. We've borrowed heavily from the work that you've done and the models that you've created through the creation of clinical academic groups. And these are the principal mechanisms through which we deliver these operational support programs as Sydney Health Partners. Maybe the next slide, I'll make that the last one. So we look a bit like this. We have a particular focus on the management of our partnership. One of the things I've learned as executive director is it's impossible to communicate enough between and within our partnership, but also increasingly we act as an advocate on behalf of our researcher communities with some of our external partners, including the state government and the federal government and the major research funding agencies. We have the 4 operational priorities that I've highlighted: supporting people, supporting innovation, undertaking this behind the scenes research enabling activity, and increasing impact by improving our understanding of implementation science. And we deliver this through this support through our clinical academic groups. And it's through this that we intend to deliver the optimal outcomes for patient and community benefit. Well, I hope that's been a whistle-stop update of where Sydney Health Partners is at. I recognise that our orientation and priorities are not the same as King's Health Partners, but I do hope that it's a useful reference point for your discussions over the next couple of days. Thanks very much again for the invitation to join you.